Hey guys, Preston NP here, and today we're talking TRT. That's Testosterone Replacement Therapy. This is a very polarizing subject, and I'm very excited to talk about it today because on one hand you have this miracle drug, and on the other, basically this poison that attacks the heart. I believe, as a licensed healthcare provider, both are huge misses. TRT is real medicine with real benefits. It's FDA regulated and it's very beneficial for individuals that qualify. However, it's very important that we do it safe and effectively. So today we're going to dive in and really discuss what that means. So let's get into it. A normal testosterone range is between 300 to 1,000 nanograms per deciliter. Now, it depends what guideline body that you're looking at, but generally this is the accepted range for most individuals. Now, this isn't a catch-all. There are many factors we look at when optimizing a TRT protocol, such as sex hormone binding globulin and estradiol. Testosterone is aromatized in the body into estrogen. What that means is that the body converts testosterone into estrogen naturally within the body. So knowing what those estrogen levels are in an individual can tell a lot about whether they're a good candidate for TRT. Additionally, there's something called sex hormone binding globulin, or SHBG, that binds to the testosterone and inactivates it within the body. For individuals with a high SHBG, one may see a prescriber prescribe a higher dose of testosterone than would be normally accepted because they know that that individual is not going to be able to circulate that free testosterone. That's the testosterone that's actually doing something in the body normally. Now, for an individual with an elevated estrogen, sometimes it's worth looking at whether that individual needs an aromatase inhibitor. What that does is it blocks the conversion of that testosterone into estrogen, which may be contributing to their symptoms. So, what sort of symptoms does an individual have that may have a low testosterone? Well, an individual with a low testosterone may be experiencing things like brain fog, fatigue, sexual dysfunction, and general feeling of malaise. That's that feeling of, I just feel poopy, I don't feel right. For these individuals, perhaps optimizing that testosterone could be beneficial. As with anything we put in the body, we always have to be cognizant of the potential side effects an individual could experience from the TRT. The most common one that we worry about is cardiovascular dysfunction. If the TRT is not titrated correctly, this could put additional strain on the heart and decrease the longevity and overall health of the individual. Additionally, it's important to note that TRT can decrease fertility. The way that works is testosterone is normally secreted endogenously, that's within the body, by the testes. Well, if we put external TRT, that's exogenous TRT, into the body, sometimes that pathway gets a little lazy, if you will, and decreases its output of endogenous testosterone. That can lead to decreases in sperm count and decreases in pituitary function. For this reason, it's very important that we gauge the overall fertility health of the individual and age and ask the patient straight up, do you want to have children? If so, maybe waiting on the TRT could be part of the discussion that we have with the provider. So as with any medication, you can clearly see that there are potential side effects that the body can experience. However, in an individual that perhaps has low drive to exercise, low sex drive, they're not feeling like they used to in the gym, they're having problems with their relationship, TRT could potentially be a great thing. If they're getting up and moving more than they normally do, this could potentially increase the impact that we have on the bone, strengthening and fortifying the bones. So we increase the bone density, we're increasing cardiovascular health because now the individual's exercising more, and we could alleviate any sexual dysfunction or low libido that the individual could be experiencing. So for people that are good candidates, this could potentially be a good therapy for the individual. And I do have lots of patients that do fabulous on it. However, it's always important that we engage in shared decision making, and there's no one size that fits all. So having an individualized plan that's tailored to that individual is paramount to the success of the therapy. So how do you know if you have low testosterone? Well, we talked about the symptoms, and of course, if those are symptoms that you'd be experiencing as an individual, it most certainly would be a conversation you'd want to have with your primary care provider. But to make it more black and white and objectify things, we always order labs. And what those labs include is a comprehensive testosterone panel that includes that SHBG we talked about, testosterone, estrogen, as well as your complete blood counts and a metabolic panel to see how your overall organ function is working. Lastly, we always want to screen the pituitary. Part of that hormone cascade is the pituitary, in that it excretes follicle stimulating hormone and luteinizing hormone, which stimulate the testes to make testosterone. Just as we mentioned earlier, an individual's pituitary can get lazy, so to speak, just like the testes, and that can drop over time. Sometimes a baby dose of human growth hormone can be beneficial to help stimulate that pituitary to do its job. So to bring this all full circle, what I'm hoping you as the audience are hearing is that this is a very stepwise approach through very thorough workups that would ultimately prompt if the TRT is an appropriate therapy or not. What I caution patients of is going to a clinic that may be writing scripts without a thorough assessment and workup. Always be conscientious of this, and always make sure that you ask your provider lots of questions. I always love it when my patients come with questions. I think it makes their care better, and it makes me better as a provider. So ask those questions, make sure your provider's doing their due diligence, because teamwork makes the dream work. Now, while you're waiting for that TRT workup, there are natural approaches to increasing that testosterone level that you can do even today. Some of those include good sleep hygiene. That's optimizing that sleep schedule and making sure that you're getting good quality sleep cycles. That has been shown through studies to help optimize that testosterone. Additionally, staying active and having a good optimized exercise routine can also help keep that testosterone optimized. Last but not least, a good nutritional plan. It goes a long way in optimizing that testosterone. Fat cells store estrogen. Estrogen competitively inhibits testosterone. That's fancy medical words for if you have a lot of fat, your estrogen's gonna be high, your testosterone's gonna be low. So getting that fat percentage down is gonna go a long way in helping optimize that testosterone and overall improving your health. All in all, TRT is one of the many great therapies we can offer through primary care to help optimize an individual's health. But this should only be done through shared decision making and an individualized, informed approach. Always ask questions. Always push your provider to be better, because we're all better when we make each other better. As always, thank you so much for tuning in. I love making these videos. Give us a like, share, subscribe. Comment down below on all things TRT that you may have burning questions about, or things that I may or may not have covered. I always love making these videos, so I thank you guys so much for giving me the opportunity to share this medical knowledge. As always, modern medicine with a nursing heart. Preston MP out.